Welcome to this discussion on Epic leadership. When I talk about Epic leadership, I'm talking about Epic Systems, known for its electronic health record software. Now, I have mentored and coached many project managers from healthcare organizations and hospitals, and I hear a resounding theme when it comes to Epic implementations, and that is a specialized project team. A successful Epic implementation is a team sport. There's a common misnomer that the project manager is key to these implementations, but that is false. Your team needs to be a blend of technical and clinical expertise. Coming into an Epic implementation, let me give you the announcement that it will be very tedious and laborious a lot of times, but you need to lean into the power of the team. Clinical champions involving clinicians, doctors and nurses right from the start. They are the end users, and their buy-in and feedback on workflows are critical. They should also act as super users who can train and support their peers. You also need a dedicated IT staff. You'll need the IT professionals to handle the technical aspects and come alongside you. Things such as hardware, networking, and data migration cannot be avoided. You need to be on the same page with these individuals. Ensure they have the necessary skills and a deep understanding of the Epic platform. It's not enough to be a coder or developer. They must understand healthcare. Vendor and consultant partnership is also very important. Epic provides its own project management methodology and certified consultants. You need to work closely with them. Even if you are a PMP, put that to the side and leverage their expertise and adhere to their best practices. You may also need third-party consultants to supplement your team's skills, because Epic is a beast. Is absolutely huge. You also need to master the Epic implementation methodology. Each Epic project typically follows a structured methodology with specific phases. Familiarize yourself with this process to ensure alignment. There are 3 steps I want to ensure you've got down pat. Number 1, pre-implementation planning. Do not rush this phase. This is where you define the project scope, budget, and governance structure. And if you are more than a figurehead project manager, then you need to conduct a thorough assessment of the hospital's readiness, current workflows, and IT infrastructure. You also need to keep your eye on testing and validation. This is crucial. It involves unit testing, system testing, and UAT, user acceptance testing. Rigorous testing with end users helps identify and resolve issues before they can disrupt patient care. You also need to have a tight go-live strategy. Determine your go-live approach. The Big Bang method involves a single large-scale rollout, while a phased approach deploys the system in stages, by department or by location. Each has its own risks and benefits, and the best choice depends on your organization's size and resources. Thirdly, focus on change management and communication. This is huge because implementing Epic is as much a cultural shift as a technical one. Effective management is essential. There are standardized workflows when you are implementing Epic. It's one of the key benefits across the organization when you're doing so. Work with stakeholders to define and standardize future state workflows before the implementation begins. You also should keep your eye on training and support. Develop a comprehensive role-based training plan for all users. Training should be ongoing and supported by at-the-elbow support during and after go-live. A robust training plan ensures that the staff feels confident and competent using the new system. You should also have transparent communication. I advise you to maintain regular transparent communication with all stakeholders. Keep everyone informed of progress, challenges, and milestones. This helps manage expectations and reduces resistance to change. Lastly, in this section, I'll just say, plan for the long term. The project doesn't end when the system goes live. Think about post-go live support. Have a dedicated support team in place for the weeks following go live. This hypercare period is essential for addressing user issues and stabilizing the system. Also think about ongoing optimization. After implementation, your focus will likely shift to optimization if you are still with the firm as a PM. The EHR should be continually improved to enhance efficiency, user experience, and patient outcomes. Going deeper into the project manager specific mindsets to have for making your Epic implementation a success, we start off with the pre-implementation that we previously discussed, going deeper in mindset and logic. Number one trumps everything else, and that is secure, strong executive sponsorship. As the project manager, you should think like this. My first priority is ensuring that this initiative has visible backing from our executive leaders. You see, Epic is not just an IT upgrade, it's a transformation in how we deliver care. We need our CEO, our CMO, and nursing leadership to champion the project. Show up at key events and make it clear that this is a hospital-wide or organization-wide priority. It's not just an IT task. Number two, establish a clinician-led governance structure. The people who will use Epic every day should have the loudest voice in shaping it. A lot of times you, the PM, may need to emphasize this. Think like this. We will set up governance groups where physicians, nurses, and allied health professionals are part of decision making. Their insights will ensure the workflows we build truly work in the real world. Number three, perform a comprehensive current state workflow analysis. Before we touch a single Epic screen, we will map exactly how each department works today. We will map out from start to finish, from admitting a patient to processing a discharge. We'll capture every step. This isn't busy work. It ensures that we don't replicate outdated or broken processes in the new system. Number four, as a project manager, prioritize standardization over customization. What do I mean by that? Well, you need to understand that Epic comes with proven best practice workflows. Our goal is to adopt those standards where possible instead of building endless custom features. Over customization adds cost, complexity, and risk. Standardization helps us maintain system stability and makes future upgrades smoother. Number five, engage a dedicated training team early. Think like this. As a project manager, I'll ensure that we identify and train super users in every department months before go live. These are our on-the-ground champions, people and staff know and trust. They'll become the go-to resources during training and at go live, easing the learning curve for their colleagues. Number six, this may not be an easy one for some PMs, but you must create a data migration roadmap. For you to be able to do this effectively, You may need additional team members working with you. Think like this. As a project manager, I will ensure that we define exactly what patient, clinical, and billing data will move into Epic and how we'll check its accuracy. This means clear ownership. Someone is responsible for validating every data set before we go live to avoid surprises on day one. I'll just say this up front, my friend. As a PM, you will likely need a whole lot of training and mentoring before you get into the swing of things. So now is actually a good time to begin looking for mentors and coaches who have done exactly this. Number 7, lock in hardware and infrastructure planning. A system like Epic only works well if the technology around it is ready. That means checking Wi-Fi coverage in every patient room, ensuring workstations and tablets are working, and removing any tech barriers that could frustrate staff at launch. Let's move on to stage 2, go live preparation. We call this execution readiness. For you to be able to pull this off sensibly, you need to conduct multiple integrated tests. And this is my number 8. Understand that as a project manager, you need to govern, plan, coordinate, integrate multiple testing cycles. Testing is not just an IT exercise. We'll run full real-life scenarios with the clinical staff to ensure that Epic supports the actual patient care journey. And that means everything from patient admission to medication administration, all before we go live. Number 9, simulate peak load scenarios. Hospitals don't operate at half speed. We will test the system under full real-world loads, emergency admissions, full clinic schedules, and busy inpatient floors to make sure Epic can handle the pressure before we flip the switch. Number 10, build a command center plan. On go live week, there are going to be questions, challenges, and unexpected issues. You'll have a physical and virtual command center where support teams, clinical experts, and decision makers can respond quickly. This will keep the hospital running smoothly while you troubleshoot in real time. Number 11, implement robust change management messaging. People adapt better to change when they understand it. Think like this. We as a team will communicate early and often about why we are moving to Epic, what's changing in day-to-day work, and how we'll support staff through the transition. That could make or break the entire implementation, my friend. Number 12, refine role-based training curricula. Training must be job-specific. You need to avoid generic one-size-fits-all classes in Epic. Surgeons, schedulers, nurses, they will all get tailored training. That needs to be your mindset, so that every hour they spend learning is relevant to their work and not just white noise. 13, validate clinical content and order sets. Before you go live, your clinical teams should review every order set and care plan in Epic to ensure they are accurate, compliant, and match the hospital's standards of care. This step directly impacts patient safety. Number 14, schedule dress rehearsals. You must run mock go-live days before the real thing. Not doing so is relying on dumb luck in your implementation. You must admit patients in the process, document, order tests, and discharge. Mock setups, all in Epic. This lets you iron out kinks before the big day. And finally, in this section is confirm contingency plans. Even the best systems can face downtime. What is your backup plan? What is your plan B? You could think like this. We'll have paper-based processes ready for admissions, prescriptions, and charting, so patient care never stops, even if the system does. Let's move on to stage 3, the big run-up. Post-go-live stabilization. It's one thing to flip the switch, but it's another thing to be stabilized and for it all to work. I call this optimization and adoption. Number 16, deploy elbow-to-elbow support. Think like this as a PM. In the first days after go live, our super users and support staff will be physically present on the floors and in clinics. If someone is stuck, help is right there, not a phone call away. Number 17, monitor metrics in real time. This needs to be your mentality. We will track how the system is performing. Things like how long it takes to chart, complete orders, or discharge patients. If those times start to slip, we'll investigate and fix the cause quickly. Number 18, create a rapid issue resolution log. Think like this. We will maintain a single transparent log of issues, who owns them, and when they're resolved. Everyone will know the status of critical fixes at any given time. Number 19, schedule optimization rounds. About 30 to 90 days in, meet with departments to review what is working and what is not. This is where you can streamline workflows and help staff work more efficiently in Epic. Number 20, the human piece. Celebrate wins and recognize champions. Change is hard, so publicly thank teams and individuals who have embraced the new system and helped others succeed. Recognition goes a long way towards building a positive culture. And number 21, plan for long-term governance, even if you plan leaving the firm. Epic is never ever truly done. You must maintain active governance groups to oversee updates, new features, and workflow improvements so your team can keep evolving with the system and patient care needs. So my friend, over the past number of minutes, I've been giving you 20 power tips for the PM's Epic implementation. As you implement Epic with your team, don't forget the most important piece of it all is not the tech, it's the human. You as a human must understand this is enormous change for people, and you should lead the way by influencing. The great John Maxwell often says, the true measure of leadership is influence, nothing more, nothing less. He also says, he who thinketh he leadeth, but has no one following after him or her is only taking a walk. So as a leader in this space of Epic implementations, you must come with your leadership hat. You need to understand that getting along with people is the most important thing. You already have the position as the PM, and that's the position, but you need people to give you permission to lead them. How do you do this? John calls this level 2 leadership. And at level 2 leadership, you are leading based on likability. People follow you because they like you. And likability is key. When leading projects of this size, it is important you maintain calm and cool, objectivity at all times, listen to both sides. Your wish and your will may not always be accepted, so it's important to understand you're working with a wider team and you need to be a facilitator, a conduit of common sense and mediation. As a project manager, you should also understand that schedules, cost, and scope are revered by stakeholders. In fact, they are always looking at the bottom line. But not every stakeholder is like that. Some stakeholders have other things that are near and dear to them, and you as the project manager must understand what those are, and that means a lot of energy will be spent. Get ready to communicate and connect by spending time, effort, energy, and active listening in this equation. If you haven't studied project management formally, understand the dimensions of project management and how they apply to your epic implementation. Integration is weaving everything together. Scope is understanding the full gamut of the implementation. Scheduling is ensuring all the tasks are listed out and are scheduled into a scheduling software tool. I often recommend Microsoft Project, but if you're not able to use that, you can use Smartsheet or something else. Costing is not always the important factor for some stakeholders in epic implementations. They already know it's going to cost a lot of money, but the most important thing to others is quality. Fitness for use, conformance to requirements, customer satisfaction, and Kaizen are huge. When it comes to resources, always be a step ahead of the game by asking the professionals and the smart people in the room, what are we missing? When it comes to communication, be transparent, communicate at the level required by the stakeholders, understand by asking questions what type and level of communication is needed. You cannot afford to ignore risk management. Risk needs to be front and center. Have a risk register, ensure that it is well governed on a weekly basis with your team and with you as a PM on a daily basis. Also understand that you can take a more agile approach to this entire thing by injecting a little bit of Scrum mindedness and the Agile Manifesto values and principles. Understand that meeting frequently is important so that any issues or impediments can be escalated to you quickly. When it comes to procurements, understanding the vendors and the consultants at play and bringing them as part of your team into the integration is important. And lastly, stakeholders, they are front and center. Spend time identifying them, planning how to engage them, and then actually engaging them and monitoring the engagement. Thank you for joining me today. This is your friend Phil. As I told you in the beginning, I have not managed these implementations, but I have mentored, coached, and trained hundreds of individuals across hospitals like Yale New Haven Hospital, St. Joseph's, and many other organizations that I cannot mention on the East Coast. Thank you for joining me, and I wish you all the best in your epic implementation. If you have any questions, send them on to info@praizion.com.